अथा तो मुखरोगचिकित्सां व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः। चतुर्विधेन स्नेहेन मधुच्चिष्टेन च वातजे अभ्यञ्जनं कुर्यात् नाडीस्वेदं च बुद्धिमान् विदध्यात् वस्त्वकोपेतु साल्वनं च उपनाहने मस्तिष्के चैव नस्ये च तैलं वातहरं हितं श्रीवेष्टकं सर्जरसं सुरदारसगुग्गुलु यष्टीं मधुकचूर्णं तु विदध्यात् प्रतिधारणम्. In the Nidana we have discussed about the possible comparative conditions of the Mukharogas, different varieties of the Mukharogas, and typical Vataja Vostaprakopa can be seen in case of exfoliative cheilitis. Exfoliative cheilitis is often produced due to the irritation of the local area, particularly due to some sort of cosmetics which can be produced the irritation over there, or occasionally it could be seen in psoriasis. Now in that condition, what Sushruta has suggested as a treatment is Madhuchista with the Snehadravyas, Beeswax with any of the other Snehadravyas, and Abhyanga, Nadi Sweda also is suggested as a treatment, and Salvana Upanaha also is suggested as treatment, and Vatahara Nasya or Mastishka also could be tried as a option of the treatment. The local application of Madhuyastuna Srivestaka also is suggested as a treatment. Now what we can do is, of course, local application of beeswax with the ghee is definitely extremely beneficial in such conditions. In exfoliative cheilitis like conditions, it immediately produces a significant clinical relief, symptomatic relief at least. And then internal administration of Kaishara Gugula Sarvadhyasava can be useful in patients with that irritation produced due to cosmetics. But in case of psoriasis induced to exfoliative conditions, you may need prolonged treatment, and even Virechana could be required in such situations. That's one. Then Pitta Raktabhigatottam Chelokobhi Upachareta Pitta Bidhradivantchapi Kriyam Kuryadasheshadha Shiro Virachan Dhumaha Svedak Kavalevacha. Pittaja Vostaprakopa or Mukharoga is compared to granulomatous cheilitis, infective pathologies, and often it is due to the trauma, previous trauma, or many times after some dental handling, dental surgery or so on, it can occur. And the treatment suggested by Sushruta is Raktamokshana and all the treatment of Pitta Vidhradi. That's initially Shopa Harak Chikitsa, then later if it becomes separated, drainage and the further cleaning of that treatment. But Shiro Vedachana also is suggested as another option. Practically, when we see such granulomatous cheilitis, which is often produced due to injury, most of the times Triphalocupul Gandhakarasayana could be enough to manage. Maybe at rare situations you may need an antibiotic therapy also, maybe if there is a severe sepsis situation. Then Kapaja Vostaprakopa is Hridaya Rakte Prayuktavyam Vostakope Kapatmake Trishunam Sarjikaksharaha Evaksharo Bidam Tatha Kshaudrayuktam Vidhatavyam Etacha Pratisaranam. Now Kapaja Vostaprakopa may be having the clinical signs suggestive of the mucocele, where there will be gelatinous swelling in the lip as which is often produced due to a previous injury, and then the embedding of the epithelial membrane into the deeper tissues, which is also called as epilis, usually painless condition. And the suggested treatment by Sushruta is Raktamokshana and local application of Kshara and then Shaudra for healing. But practically, excision is a relatively simple process, very simple process. Like if we just make a very superficial incision, the whole cyst can be, mucocele can be excised as such, and that's a better, easier option of the treatment. Then Medoja Vostaprakopa, Medoja Sverite Bhinne Shodhite Jolanohitaha Priyongo Triphala Lothram Sakshodram Pratisaranam Yetad Vostaprakopanam Sathyanam Karmakirtidam. The Medoja Vostaprakopa, the treatment suggested by Sushruta is Svedana, and then Bhedana, incision is to be done, and the Agnikarma also is suggested as such. The typical presentation of the Medoja which we can see is in case of the lymphangioma of the lips. Lymphangioma of the lips is again a primarily surgical condition, and the surgery also is a complex surgery. It's not a simple drainage procedure. It needs a vascular reconstruction, but you need to have the cosmetic appearance too. So the present situation, lymphangioma of the lips is in the domain of cosmetic surgery, and it has to be planned very well, and you need that fine-tuned vascular approach, not simply drainage as suggested by Sushruta. Then the Dandagata Roga, among the now these are the Sadhya Vyadhis, Vosha Prakopa. The Tridosha Vosha Prakopa is considered as a Sadhya by Sushruta, and hence the treatment is not suggested. Then Dantamulagatanam to Roganam Karma Vakshare, Shita, De Hritarate to Tuye Nagara Sarshapana, Nishpathya Tripalam Mustam Gandusha Sarasanjana, Priyangavasta Mustam Tripala Pralepanam, Nastan Tripala Sitam Mathuka Utpala Padmakehi. Now, in case of Dantamulagata Roga, among them Shitada is something like hemorrhagic gingivitis, and in that condition, Sushruta has suggested Triphala Kvata. Of course, even now Triphala Kvata is one of the best options. Gandusha with the Triphala Kvata, gargling with the Triphala Kvata can be a very effective treatment in majority of the diseases of the gums and teeth. And in that condition, the other options are these Rasanjana also for the Gandusha, and the Priyangu Musta Triphala can be applied over the lepa. Now, and Nasya, Triphala Nasya. From what we practically can do is, one is a Triphala Kvata gargling, and maybe if it's a localized one, I would prefer to have a massage with Dashangalepa. Dashangalepa powder is applied over the area, and gentle massage is done, which can help in reducing the bleeding as well as the irritation very significantly. Then internal administration of Kamaduga and Gandhakarasayana often helps in the recovery, early recovery as such. Then Dantaputake Karyam Tarune to Raktamokshanam, Sapancha Lavana Ksharaha Sakshodra Pratyaranam, Hitaha Shiro Virekashta, Nasyam Snigdham Bojanam. The Dantaputaka is typically the abscess in the gum, which is produced due to the septic lesion, and Sushruta has suggested Raktamokshana and Kshara with the Panchalavana and Kshaudra also, or Shiro Vireka Nasya also is suggested. Of course, practically, a simple drainage is good enough. You just make a superficial incision and the drainage has to be done. Most of the times it gets drained spontaneously, and then if after the drainage, if necessary, you may give Triphalagugulgandhakarsana or antibiotic also if necessary. Then the Danta waste is a Visravite Dantaviste Vranamstu Pratisare, Rothra Patanga Yastahwa Laksha Chuni Madhutarihi, Gandushe Kshirino Yodjaha Sakshodra Kritasharkaraha, Kakor Yadav Dashak Shira Siddham Sarpistana Sedaha. Now, in case of Danta Vesta, that's the gum boil, where there is a bubble-like situation, which is often produced due to a sort of mucocele. It's also a mucocele in the gum. And the suggested treatment by Sushruta is the Pratisarana with the Rodha Patanga, etc., and Gandusha with the Kshiri Vrikshakashayas, with the Ghrita and Sharkara. Practically, in such situation, excision is a better treatment. Because even after your local treatment, if the membrane is left over, it may result in recurrence. Very often it happens like the gum boil may get ruptured, and then temporarily that boil may not be persist for a certain period of time. Then again there is a recurrence, and when it recurs, usually the size will be bigger, like initially one boil, then you'll have two, and so on. There can be sequences of such things also, many times it happens, and in such conditions, the treatment option is excision. Then Danta Shushira is Shaushira Hitarakteto, Rodha Mustara Sanjanihi, Sakshodrihi, Shasyate Lepo, Gatu Shek Shiranaldaha, Sariva Uttala Yastahva, Savara Aguru Chandanihi, Kshire Dashagune Siddham Sarpin, Sage Pujitam. In the tooth root abscess, particularly periapical root abscess, where the tooth root is not completely involved and there is a whole tract formed in the tooth root, Sushruta has suggested Raktamokshana and the lepa, local application of lepa with the, and Gandusha with the Kshira Vrikshakashaya and Sariva and Nasya also is suggested. In the present day situation, the better option and very popular option is the root canal treatment, which is in the domain of the dentistry as such. Now, or if it is inevitable, if the condition has become very gross and the sustainability of the tooth is not possible, removal of the tooth, extraction of the tooth also is the other option of the treatment. The technologies in the dentistry has now developed very remarkably, so you will have plenty of different options of the root canal management, and the degree of assessment of this condition also is now has become very complex. Of course, to a certain extent, we have discussed this during the Nidana. In the Nidana chapter, I have referred to that different classifications and the degrees of assessment of the tooth root abscess caries varieties like. Then Kriyam Paridare Kuryat Shitado Uttam Vichakshana. In the Paridara or periodontitis, the same treatment as that of the Shitada, like local Gandusha is suggested. Of course, in the present day situation also, I would prefer Cephalopatha gargling and the Shankarepa massage with the Shankarepa in such conditions, and it's a quite common condition. Periodontitis is quite common. Maintenance of the hygiene of the gum is most important in such conditions. Then संशद्य उभयतत् कार्यं शिशिरश्च उपकुशे तथा काकोदुम्बरिका गोजी पत्रैः विस्रावयेत् असृक् क्षौत्रयुक्तैश्च लवणैः सव्योषैः प्रतिसारयेत् पिप्पलीः सर्षपां च श्वेतां नागरं नैजुलं फलं सुखोदकेन संसृज्य कवलं चापि धारयेत् घृतं मधुकैः सिद्धं हितं कवलनस्यैवः. Upakusha, which has all the clinical features of hypertrophy of the gums. Now, in the present day situation, hypertrophy of the gums is seen more frequently as a consequence of the adverse effects of the drugs, particularly, very particularly, anti-epileptic drugs like hydrotide, diphenylhydrotide, and it also can occur as a genetic pathology also, rarely. Now, Sushruta suggested treatment is a Visravana, Rakta Visravana, by rubbing over the area, sort of lekhana, curating, and then Rakta Visravana is done. And the local pratisarana is the lavana and the tikot. Then Kavaladharana also is suggested as a treatment. Even now, in such conditions of gum hypertrophy, the option of the treatment is curating. Most of the times it is with a cautery, because once that extra hypertrophied gum is removed, the pain will reduce. That's all the point. But in all such conditions where the patient has a hypertrophy of the gums, the scurvy has to be ruled out. In case of the scurvy, if you do the curating, there can be extensive bleeding. So before going for curating any intervention, it's important that the scurvy has to be ruled out. Then the hypersensitive tooth is a Danta Vedarbha. शस्त्रेण दन्तवे दन्तमूलानि शोधयेत् तत्र क्षारं प्रयुञ्जितक्रिया सर्वाश्च शीतलः. Dantavidarbha, according to Sushruta, the clinical presentation is like this hypersensitive tooth, and a hypersensitive tooth now has to be a major subject of clinical evaluation. The causes have to be evaluated very carefully, and then most of the times the causes could be related to the this nerve irritation of the tooth root abnormalities or abscess in the tooth root also. Inflammatory pathology in the tooth root can be one of the most common causes, or atrophy of the gums and so on also can produce the hypersensitive tooth. And approach to the treatment would be based upon this identification of the cause. It could be multiple different varieties, but symptomatic treatment of hypersensitive tooth is a local anesthetics. Gargling with the local anesthetics is suggested as one of the options of the treatment. But it is better that the patient of hypersensitive tooth has to be evaluated carefully, and the treatment, suitable treatment has to be done. Like if it is a pathology of the enamel of the tooth, that has to be have a cover like cap. If it is a pathology of the root, then a root canal has to be done. If it is a pathology of the gums, then the treatment has to be accordingly as such. Then the adhidanta is udhritya adhikadantam matato agnim avachareta krimidantavacchapi vijikkaryo vijanata. In case of adhidanta or hyperdontia, where you have supernumerary teeth, even now the option of the treatment is extraction. That extra teeth have to be removed, and or the Sushruta has suggested the treatment as that of the caries, and in the caries also, Kanvidanta also, the suggested treatment by Sushruta is mainly extraction, so it is almost the same as it. But extraction of these extra or hypertonsure requires a very careful evaluation of the anatomy and detailed procedure. It's not a simple extraction, unlike other normal teeth where simple give local anesthesia and then pull out the tooth. It's not possible. You need to assess the anatomy, the location of the root and shape of the root has to be assessed carefully, and then suitably it has to be planned. Then चित्वा अधिमांसं सक्षौद्रैः अभिचूर्णैमुपाचरेत वचा तेजोवती पाठः स्वर्जिकाय आवशूकजैः क्षौद्रद्वितीयाः पिप्पल्यः कवलश्चात्रकीर्तितः पटोलत्रिफला निम्बकषायश्चात्र धावने हितः शिरोविलेकश्च धूमो विरेचनश्च सः. In Adhivamsa is obviously the impacted wisdom tooth, wisdom tooth which produces acute pain, and initially there will be only a soft bulging. Later on you may be able to see the hard tooth below that area. And Sushruta has suggested the treatment like the local application of the churna, at the same churna which is mentioned in the Adhidanta, or Vacha Tejavati Pata Swabjika. These the drugs also can be used for the churna, or Kavala with the along with the this honey, and Shiro Vilachana, Dhumapana also is suggested as such. But from the present day's point of view, the option of the treatment is extraction. And again, the extraction is an elaborate procedure, unlike that of the normal teeth. In case of wisdom tooth, the anatomy has to be defined properly, and then the extraction has to be a very detailed procedure. Then Dantanadi is the caries, and Sushruta has suggested the different degrees of the Dantanadi, and the approach to the treatment also depending upon the degrees. And those are Samanyam Karma Nadinam Vishesham Chatrameishunu Nadi Vranaharam Karma Dantan Adishu Karayeta Yam Dantam Abhijayeta Nadim Tam Dantam Uddhareta. Now, primary approach to the treatment of Dantanadi or caries is you have to follow the same line of treatment as that of the other nadis, other sinuses, like curative, and then if not, if you have identified the first caries, the spot of origin of the caries, that tooth has to be removed. Then Chitva Mamsani Shastrena Yadina Uparijopaveda Shodhayitva Dahetchapi Ksharena Jwalanena Tva Bhinatti Upekshite Dante Hanukastik Bhagatirthvam Samulam Dashanam Tasmad Uddharet Bhagnam Asthiram. In case of the caries, there is always a risk of the extension of the same into the bones, either the mandible or the maxilla. And Sushruta has suggested, particularly in case of the mandibular lesions, that's lower jaw, the treatment has to be very energetic. It has to be removed, and then the spot, the root of that caries area has to be cauterized, otherwise there is a possibility of extension of the same. And this is absolutely true. Caries, if it is not handled properly, it can extend, and it can even produce osteomyelitis lesions also. And hence early treatment of the caries is always suggested. Then in case of upper jaw, Uddhite Uttare Dante Samudre Sthirabandhane Raktat Yoga Puroktaha Roga Ghorah Bhavanbihi Kanas Sanjayate Dantu Ardhitam Asajayate Chalamappi Uttaram Danta Matona Apahare Bishaka. In the upper jaw, there is a high risk of involvement of blood vessels and nerves, and hence the patient may have either excess of bleeding or even maybe the palsy. It's again the important facial anatomy was known to was very detailed studied by Sushruta, and hence in case of upper jaw, Sushruta prefers not to remove the tooth. The teeth has not to be removed. As well as possible, you try to preserve the tooth as such. Then the Dhavane Jati Madana Swadu Kantaka Khadiram Kashayam Jati Madana Katukas Swadu Kantakehi Yastya for Rodra Manjista Khadrish Chapi Yatkritam Tailam Samshodram Tadi Hanya Dantakatam Gatim Kirtita Dantam Nulet Priya Danteshu Akshare. The other options are the Kashaya with the Jati Madana etc. Kashaya Saldavya, or it could be Taila, Samshodhana Taila also could be used as the treatment option for the caries of the tooth. Then the next is about Danta Sharkara. There Snehanam Kavala Kosnaha Sarpishas Trivurdasya Niruhashta Anilagnanam Danta Harsha Pramardanaha Snehika Shehito Dhumo Nasyam Snigthanti Bojanam Raso Rasayavagvashta Kshiram Santanika Gustam Shiro Basti Hitaschapi Kramo Yashta Anilapaha Ahimsan Danta Mulani Sharkaram Thare Bishaka Laksha Churnihi Madhitehi Tatastaha Pratsarayat Danta Kriyanchapi Kriyat Niravasheshataha. In Danta Sharkara or the tartar, the first option is prevention. To prevent the kavala and the grisapana or any dhumapana, snehika dhumapana, nasya also is suggested. Of course, it is absolutely true that tartar can be prevented by maintaining the oral hygiene effectively, and most of the times it is due to the improper food and the deposition of the residual food substances over the teeth that the tartar is triggered. But once the tartar has developed, then the option is you have to curate it out. That's what Sushruta also suggested. Ahimsan Dandamulani Sharkara Mudhareta. Without injuring the tooth root or enamel of the tooth, you have to remove the tartar, curate the tartar as such. Now, and then application of Laksha Churna, etc. In the current dental practice, of course, the primary treatment is curating. Now, of course, you have some chemicals or even surgical curating also is practiced. But most important is maintenance of the oral hygiene as such. Then, Kapalika Krishnatama Tatra Pyesha Kriyahita Jayel Visravanaihi Swinnam Achalam Krimidantakam Yatha Avapidaihi Vatagnihi Snegandushadaranihi Bhadradarvadi Varsha Bhulepaihi Snigdeshta Bhojanehi Chalam Udhritya Sthanam Vidahet Swishrasya cha Tato Vidari Yastyahva Shungataka Kaserukehi Tailam Dashigune Kshire Siddham Nasehidam Bhaveta. Kapalika is again an extension of the tartar where the tooth has become completely atrophied, or in case of Krimidantaka where again there is a significant infection and then the tooth has become or tooth enamel has become completely destroyed. In such conditions, Sushruta has suggested that they are Kritshatama. The disease condition is a quite difficult option of the treatment, and then the other options of the treatment are Rakta Visravana and Avapidanasya, Gandusha, Snehadharana, etc. are suggested. And when the tooth has become completely unstable, then it has to be removed, and after removal, the cavity has to be cauterized. That's what Sushruta has suggested as it. Now also the treatment options, there are no definite curative option in case of dental atrophy. The present options are you remove the tooth and then you say implant. New tooth can be inserted in. Then Hanumoksha is a dislocation of the maxillomandibular joint, which is not in the domain of dentistry, but now it's a practice of the orthopedics. Of course, dentists also can be in managing that. But Sushruta, according to that, it's considered as Dantaroga as such. Hanumoksha Samudishtam Kuryacha Arditavakriyam Phalani Amlani Shitambu Rukshanam Dantadhavanam Tatha Atikatinan Bhakshan Dantarogi Vivrjayat Sadhyanam Dantaroganam Chikitsidam Udiritam. The Hanumoksha is a dislocation of the maxillomandibular joint, which is a common event, and the most important technique of reduction has to be known. See, it's a very simple method of reduction, but if as the patient is not able to close the mouth, if you attempt to close the mouth by putting the pressure on the chin directly, the styloid process can be broken and the condition becomes worse. So the better option or the correct method of reduction is you have to put the finger in and put the pressure on the molar, last molar tooth, and the whole posterior aspect of the chin has to be depressed down, and then the mandible has to be lifted up and the area has, the mouth has to be closed. Otherwise, there is a possibility of a styloid process fracture, and this procedure has to be carefully known, and every practitioner should know that, because the procedure is simple and the incidence of maxillomandibular dislocations also are quite common as such. That's about the different dantarogas. Then comes the Jihvagata. Jihvagatanam Sankhyanam Karma Aksham Siddhahe Osak Prakope Anilaje Yaduttam Prakchikitsidam Kantakeshu Anilotheshu Tatkaryam Bhishja Bhaveta. The Jihva Kantaka are the abnormalities of the tongue surface, different sorts of the polyps. Now, Sushruta has suggested a general line of the treatment like as discussed in case of Osta Procopa. Similar options of the treatment could be tried in case of the Jihva Procopa or glossitis, inflammatory pathologies of the tongue. And the options again are Vataja condition, it's Vatahara, Pittaja conditions where there is a hypertrophy with the inflammation. Vighrusteshu niskrite vishashonite pratisarana gandusham nasyanta madhuram hidam. The pratisarana gandusha are suggested after raktamoksha. Kantakeshu kafotteshu likhiteshu asrujakshye pipalyadihi madhuyutaha karyastu pratisarane. In Kapaja variety of the Jihva Kantaka or Jihva Prokopa, the treatment is a Pipalyadgrita and Madhu acid. And Kavalas, Gruniyat Kavalam Stabi Gora Sarshapasandehi, Patola Nimba Varta Kshara Yushish Bhujaita. These are the options of the treatment in case of the Jihva Prokopa or the different glossitis. Now, in the present day situation, a patient presenting with the abnormality of the tongue surface has to be analyzed for the different causes. I think we have discussed that part to a certain extent in case of the Nidana as well as in the GIT pathologies. We have discussed that in detail, like how many of the systemic disorders can be identified by looking at the tongue surface. So, abnormalities of the tongue surface you need to analyze and identify the possible causes. 1 minute, I just call. Hello, Heli. Heli. Hello, Heli. Hello, Heli. Hello, Heli. ಇನ್ಸುಲಿನ್ 5 ಯೂನಿಟ್ ಕೊಟ್ಟರೆ ಸಾಕು ಈಗ ಬೆಳಿಗ್ಗೆ ಮತ್ತೆ ನೋಡ್ತೇವೆ. ಮತ್ತೊಂದು ಯೂನಿಟ್ 6 ಸ್ಟಾರ್ಟ್ ಮಾಡಿ. Then that's about the treatment of Jihva Kantakas. And in the present day situation, you will have to analyze the causes, systemic pathologies have to be identified, and then the correct treatment has to be followed. It may not be possible to generalize a single treatment as such, and the better option is Gandushas. The Triphala Pata Gandusha is one of the simple option which can be advised in all patients of the abnormalities of glossitis varieties. Then Upajihva, where there is a real hypertrophy of the polyps. Sambikhya Ksharayana Pratisarita Shiro Vireka Gandusha Dhumeshcha Enam Upahareta Jihva Gatanam Karmoktam. In case of hypertrophy, Susha has suggested Kshara and Shiro Vireka Gandusha, etc. Then that's about the Jihva Gatabhya. Then comes the Talavya. Among the Talavya, Angusta Anguli Sandamshena Akrishya Galashundikam Chedayet Mandalagrena Jihvo Parija Samsidam. न उत्कृष्टं चैव हीनं च त्रिभागं छेदयेत् विषक् अत्यादानात् स्रवेत् रक्तं तन्निमित्तं दीयेत च हीनच्छेदात् भवेत् शोभः लाला निद्रा भ्रमस्तमः तस्मात् वैद्यप्रयत्नेन दुष्टकर्मा विशारदः गलशुण्डीं तु संच्छिद्य कुर्यात् प्राप्तम् इमं क्रमं मरिच अतिविषापाठावात् वचा कुष्ठकुटन्नतैः क्षौत्रयुक्तैः चलवणैः ततस्तां प्रतिसारयेत् वचाम् अतिविषां पाठां भ्रास्नां कटुकरोहिणीं निष्काथ्य पिटुमन्दं च कवलं तत्र योजयेत् इङ्गुदी किलिः दन्ती सुरदारुभिः पञ्चाङ्गीं कारयेत् पिष्टैः वर्तिं गन्धोत्तरां शुभं ततो धूमं पिबेत् जन्तुः द्विरह्नः कपनाशनं क्षारसिद्धेषु मुद्गेषु युषश्चाप्यशनैहितः. The Arshundika is buvulitis, inflamed buvula, and Sushruta has detailed procedure of the buvulectomy, the removal of the buvula, and it has to be done with the Mandalagra Shastra, and it should be cut properly. If it is cut beyond that limit, the base is cut over, in excess, there can be severe bleeding and the patient may die due to that also. Or if the removal is not sufficient, if only the part of the tip is removed, then it can result in a swelling and then later irritation. And once the surgery is done, then you will have to give pratisarana with the marichativisha, etc. And then taila, kavala, the dhumapana are suggested treatment. Of course, uvulitis is quite common now, and the majority of the patients of moderate uvulitis can be managed medically with Triphalabhukulum, Mrityunjaya, Samritarishta, or so on, which is a common treatment. Very rarely you may have such a huge uvula where it can produce a continuous irritation and requires surgical treatment. Uvulectomy is now relatively less popular because with the present protocols of the treatment, many of the uvulators can be managed conservatively. But in case of that hypertrophy, of course, uvulectomy is the option of the treatment. Then Tundikeri Adhushe Kurme Sanghate Talupute Eshe Vidikkarya Vishesha Shastrakarmani Talupake Chakartavim Vithanam Pittanashanam Sneha Svedo Talushoshe Vidishcha Anilashana Kirtidan Talajanam. So Tundikeri Adhusha and Kurma, the different conditions of the palate, either tonsillitis or palatine tumors and so on. Sushila has suggested surgical treatment and Talupaka in the inflammatory pathologies of the palate. Then Pittanasham, treatment for Pitta, anti-inflammatory treatment is suggested. Then the last Kanta Rohini, Sadhya in general is considered as a Sadhya, and among them Sadhyanam Rohinanam Hitam Shonita Mokshanam Chaddanam Dhumapanam Cha Gandusho Nasekarmaja Vatikim to Hute Rakte Lavani Pratisaret Sukoshnena Snegandushan Dhare Chapi Abhikshnasha Padanga Sharkara Chaudri Paitikam Pratisaret Draksha Parushaka Patha Hidasha Kavalagrahe Agara Dhumakatuke Sveshmikim Pratisare Shweta Vidanga Dandi Shudelam Siddham Sasaindavam Nasekarmani Yuktavim Tatat Kavaladharane Pittabat Sade Vaidyo Rohinim Raktasambho in Kantarohini, that's which looks like or which we generally consider as the diphtheria-like condition. Sushila has suggested the treatment of Pratisarana in this chapter, different sorts of Pratisarana depending upon the dosha lakshana. In case of Vataja, it has to be the Labana used for Pratisarana with Vamana, Dhumapana, Gandusha, Nasekarma. Whereas in Pittaja, it's the Pratisarana with the Patlanga Sharkara, etc. In Kapaja, Agara Dhuma Katuka, etc. So the selection of the drug would be based upon those lakshanas. And but in case of the classification of the Shastrasadhi Vyadi, Rohini is considered as a Lekha Vyadi. Lekhana is suggested at that context. Now, in case of diphtheria, of course, the incidence of diphtheria has become almost nil now. Since past 10 years in India, diphtheria is not reported, but earlier it was there. So you may not have an opportunity to treat diphtheria now because of the immunization. The standard protocol of the treatment would be antibiotics and, if necessary, tracheostomy. Instead of handling that pseudomembrane which is formed at the throat, it's better to keep it as such without handling because it can result in exotoxins. Anyway, diphtheria now has become somewhat less relevant as we have no very less chance of coming across a case of diphtheria. Then Visravya Kantashalukam Sadayet Tundikeri Vata Ekakalam Yavanam Bhunjita Snigdham Alpashaha. Kantashaluka is a pharyngeal dermoid cyst in the pharyngeal area which can produce obstruction. And Sushruta has suggested the similar treatment of Tundikeri like excision. You have to make an incision and excise followed by the usual protocol of the treatment of wound. Even now, the option of the treatment is excision only. There is no change in that. It has to be excised. Then Upadishvika Sadhayat Adhijishvika is epiglottitis, and there again the treatment is like Upadishvika, where it could be like the surgical treatment suggested by Sushruta. But in the present day situation, in case of epiglottitis like condition, you may not require surgical treatment. Most of the times it can be managed with the conservative management, and I would prefer Triphalagupul Mrityunjaya in majority of the cases. Rarely you may fail in that condition. Most of the times it could be due to the irritation, local irritation. So you need to take care of the food, the diet, spicy food and oily food or cold things have to be avoided. Occasionally you may require an antibiotic also in case of epiglottitis. Then Ekavrundam to Visravyam Vidhim Shodhanam Achareta. Ekavrunda and Vrunda, which could be the different varieties of the diverticulae, sacs formed around the neck area. The Sushruta has suggested Shodhana. You have to give Vamana Birechana and then local cleaning. Of course, as far as the diverticulae are concerned, the diverticulae are harmless as long as they do not get inflamed. So, if you maintain hygiene and keep it clean, that extra cavity which is formed there due to the diverticulum, if it is cleared properly, there will be no harm or no complications developed. But if it becomes inflamed, then the diverticulitis would occur. In such conditions, you may require any option of the treatment. The options of the treatment could be either drainage or the surgical correction. In huge conditions, surgical correction could be needed, absolutely. But surgery is again a very complex surgery there. Then Gilayushtapi Yovyachistam Shastrena Sadhayat. Gilayu is where there is a heart swelling in the submandibular area, like submandibular lymphadenopathy. A patient presenting with the submandibular lymphadenopathy, you need to have a detailed workout, and the causes could be many. So, excision for the study, biopsy is the standard protocol of the treatment now. Whereas Sushruta has suggested a general line of the treatment of surgery in such conditions. Okay, surgery is the treatment, but now after the surgery, we do follow for the biopsy and then follow up the treatment. Then Galavidhrati, Amarmastham Supak Panjab Bihde Galavidhrati. Galavidhrati is a retropharyngeal abscess, and Sushruta has suggested the treatment of Bhedana, incision and drainage. That even now the treatment is the same, incision and drainage is the option, but unlike other superficial abscesses, the drainage procedure is somewhat difficult, but it's the only option there in case of the retropharyngeal abscess. Important from the clinical point of view is retropharyngeal abscess has to be differentiated from the these extraspinal lesions or paraspinal abscess conditions, because the plane of the pus would be quite deep, and in paraspinal abscess there is always a risk of involvement of the nerves, and in case of retropharyngeal abscess the involvement of the nerves would not be seen, and the obvious evidences would be the midline in the posterior pharyngeal surface, the midline line, that raphe seen. In case of retropharyngeal abscess, it will be pushed to a side, whereas in case of the paraspinal abscess, it will be bulged in the midline. So when it is shifted to one side, it's a retropharyngeal abscess. A important clinical clue to differentiate between retropharyngeal abscess and the others as well. Then the Sarvasara is Vatat Sarvasaram Churnehi Lavanihi Pracharayat Tailam Matare Siddham Hitam Kavaladaseho Tato Asme Snaikam Dhumam Imam Dadyadjakshanaha Shala Rajadana Eranda Sara Imbuda Madhukajaha Majjano Guludhyama Mamsi Kalan Sarivaha Sri Sarjarasa Shailaya Madhu Chistanicha Hret Tat Sarvam Sukradam Churnam Snehena Alodya Itidha Tintuka Vrudram Sakshavdram Matimam Stenalepet Eshat Sarusare Dhumaha Prashasta Snehika Madha Kapagno Martagnashtam Mukharoga Vinashanaha. In Sarvasara, there's a extensive stomatitis. Depending upon the dosha lakshana, Sushruta has suggested either Vatahara Taila and Kavala Nasya, or the Pittahara chikitsa as such, depending upon the disease conditions. Now, in the present day situation, whenever you see such conditions, you will have to consider different disease conditions. Simple stomatitis produced due to the deficiency, or stomatitis like produced due to chickenpox, virus, or candidiasis, they need to be assessed, and then they have to be treated accordingly. Now, in case of Vataja Sarvasara, Sushruta has suggested Spoti Sataudehi Vadanam Samantat Yasyachitam Sarvasara Sabatat Rakti Sadahi Tanubhip Satitehi Yasyachitam Chapi Pittaka Kandu Yitehi Alparujehi Sravanihi Syat Achitam Chapi Saiva Kafena Raktena Pittu Eka Eva Kishit Pradishtas Mukapakasanyaha. So, the important is identification of these causes and then treatment. I won't suggest a single treatment for the Mukhapaka. You have to assess this, and accordingly the condition has to be treated. If the patient has a chickenpox, you will see vesicular eruptions over there, which even can involve the palatine surface. And in case of HSV virus, you will have extensive inflammatory pathology and then systemic involvement. Candidiasis, that whitish plague-like appearances. Simple stomatitis, of course, you will have different varieties which we have discussed in the gastrointestinal tract pathology. And the treatment will be accordingly assessed. Now, Pittatmake Sarvasare Shuddhakaya Silehina Sarva Pittahat Karya Vidhi Madhur Shitaraha Pratisarana Gandushe Dhumas Samshodhanancha Kapatmake Sarvasare Vidhin Kuryat Kapabham Pibed Adivisham Patham Mustam Sarvadaraja Rohinim Katukakyancha Kutajasya Palanaja गवामूत्रेण नोजः भागैः धरणसंहितैः एष सर्वान् कृमिकृतान् रोगान् योगो अपकर्षति. If it is a pitta variety, it has to be pitta sadhara. Majority of the simple stomatitis conditions produced due to spicy food, they are of pitta variety, and the most frequently used treatment which I would prefer prescription would be Kamadharasa and Madhyasti Churna is the most frequently used. But important is you need to analyze the cause and then treat. The other underlying causes should not be missed. Of course, it is true that more than 80% of the patients presenting with ulcers in the mouth are the typical simple stomatitis produced with irritation, and they respond to Kamadaka and Madhyasti, but other conditions have to be assessed. क्षीर ईक्षुरस गोमूत्र दधिमस्तु अम्लकांजिकैः विदध्यात् कवलान्वीक्ष्य दोषं तैलघृतेरपि Kabala also is suggested as a treatment. Of course, Triphalapata Kashaya or Kavala also is suggested as a general line of the treatment in such conditions. Rogadam Mukhajatanam Sathyanam Karmakirtitam Asadhya Vivakshante Roga E Tatra Kirtitaha Vosta Prakope Varjah Syum Mamsa Rakta Tridoshajaha. In the Vosta Prakopa, Mamsaja Raktaja Tridoshaja are incurable and they are not considered. Dantamulesh Varjya Trilinga Gati Saushira, Tridosha Gati and Saushira are considered as Asadhya. Dantesh Kanasibjanti Shava Dalana Bhajana, Shava Danta, Dalana and Bhajana are not treated. And Jifagateshu Alasastu, Taleshu, Talaveshu, Arbudam Tata, Soragno, Valayo, Rundo, Vidari, Alasayaja, Galavsto, Mamsatanasha, Shatagni, Rohini Jaya. Asadhya Chitrashete Roga Navadashaivaja. Rohini is also considered as Asadhya, but the treatment protocol is mentioned earlier. So bit of controversy. Other conditions they are considered as Asadhya and their treatment is not mentioned by Sushila. Vrinda is considered as Asadhya, but Ekavrinda is considered as Sadhya as such. Tesham Kriyam Vaidya Pratyakhyaya Samacharita. Even if they are Asadhya, you need to treat them by predicting the prognosis clearly. Iti Sushrutasayamnitayam chikitsa Mukharoga chikitsam nama dvavimshodhyayah. So Mukharoga chikitsa is completed. If there are any questions, we'll try to answer and then wind up. Right? Okay, there are no questions, so we'll wind up. Thank you.